Esther Venning, a partner normally based in our Leeds office. Today I want to tell you about work we've been doing with St Helens Cares, a collaboration of health and care organisations in St Helens who, like many of our clients, are looking to work more closely together to improve health outcomes for their local population. This reflects the national policy direction, which is encouraging health and care organisations to integrate as far as possible within current legislation. We've worked with all system partners in St Helens Cares, including the local acute, community and mental health providers, to put in place a formal collaboration agreement underpinning integrated working. We developed the governance structure with an integrated executive leadership team overseeing health, public health and social care commissioning right across St Helens. This has provided a framework for the partners to come together to plan the integrated delivery of services centred around patients. The foundations for effective collaborative action to support local communities were therefore already in place when the COVID-19 pandemic hit in March. For example, St Helens Cares had already established an integrated contact centre covering a whole range of needs, meaning that local people didn't need to phone around lots of different organisations to get help. We're now designing an integrated care partnership model for St Helens in the next phase of their development, and are working with many other systems nationally on similar collaborative arrangements. On a national level, we expect new legislation to build on the ambitions of the NHS long-term plan, which we hope will include tools to help systems collaborate more easily and overcome the legal barriers that currently exist. If you want to read more about St Helens Cares, please visit our website where there's a detailed case study available.
Hello, my name is Louise Wilson and I am a Senior Associate and Solicitor Advocate in the Health Advisory Team in Liverpool. Technology has been moving on rapidly and the Mental Health Act is starting to catch up. For those of you with any involvement with mental health patients, it's important to be aware that new regulations come into force on the 1st of December 2020, allowing for certain statutory forms relating to the powers of admission, detention and treatment under Part 2 of the Mental Health Act to be served electronically, if those bodies or authorities which receive the forms agree to receive them electronically. However, those forms cannot be served solely by electronic means upon patients. Forms can still be provided via non-electronic means. The regulations just give the necessary authority for electronic provision. Service is considered to take place immediately, with one exception relating to an order for discharge by the nearest relative, which would be the next business day after the order was served electronically. There is new wording for the statutory forms. A transitional provision applies to allow for the use of the old statutory forms when served by non-electronic means up until the 1st of February 2021. However, for electronic provision, it must be the new forms from the 1st of December 2020. This is a welcome step for practitioners and statutory bodies alike, putting what has been happening already in some areas during the height of the pandemic on a clear legal footing. If you would like any further advice or assistance in relation to the regulations, please do not hesitate to contact the Health Advisory Team.
Hello, my name is Monia Sood and I'm a Legal Director in the Health Litigation Team in Manchester. Recently, the Clinical Negligence COVID-19 protocol between NHS Resolution and claimant solicitors has come into force. This has encouraged a collaborative working approach between the parties and also agrees automatic extensions to the limitation period, which will hopefully avoid parties incurring unnecessary court costs. In addition, the Court of Appeal judgment in Swift and Carpenter has now been handed down. The previous approach meant that claimants were limited in what they could claim for new accommodation because of the negative discount rate. The new approach means that you calculate the additional cost of buying the property, but give credit for the increased value at the time of the claimant's death. What this means in practice is that claimants who have long life expectations will now recover significantly more for the cost of housing. The judgment, however, did not deal with the approach the court will take for claimants with a shorter life expectation, and it's unclear whether or not the decision will be appealed. An important decision was also handed down by Master Whelan in relation to Court of Protection costs, and the practical implication of this is that Court of Protection costs are likely to increase by 20%. And finally, NHS Resolution have now circulated their up-to-date scorecards to NHS trusts. If you'd like any further information, please do not hesitate to get in touch.